Thank you, Raj. It really is surreal thinking back to this event a year ago and talking on stage in San Francisco about the important role partnerships with the tech community would play in COVID-19 response. I don't think any of us could have anticipated that a year later we would have to gather virtually, but there are certainly many lessons to share in terms of the role tech has played over the past year and the role it can play moving forward. And that's what we're about to tackle in this first session to kick off our day. Joining us to speak about that topic, I'd like to introduce our panelists. Shivon Byamukama is Managing Director of Babyl Rwanda. Babyl Rwanda is a subsidiary of Babylon Health, which is a global digital healthcare provider offering telehealth services. Jennifer Gardy is Deputy Director for Surveillance, Data, and Epidemiology on the malaria team at the Bill and Melinda Gates Foundation, though as you can imagine, over the past year, she's been very focused on COVID-19 response. Inder Singh is the founder and CEO of Kinsa, a company that uses its network of smart thermometers to curb the spread of infectious diseases. And Abou Kampo is Director of Health at UNICEF, which many of you know is a United Nations agency responsible for providing humanitarian and developmental aid to children worldwide. So let's dive right in. Jen, my first question is for you. When you joined the Gates Foundation 2 years ago on the malaria team, of course, couldn't have anticipated what you'd be doing right now on COVID-19 response. You wrote that leveraging the potential of sequencing and data to advance global health, quote, will require thoughtful rollout if it's to be sustainably transformative, add value to local health programs, and be community driven. So that was your idea going in. And I'm just curious, how has that played out in your work on COVID-19 over the past year?
Oh my goodness, I think we could organize an entire conference around this theme. But for me, I think it boils down to when you've got an organization that holds those values that you just articulated dear, when everyone there has an internal compass that's really calibrated to equitable access to technology, even when you're in pandemic emergency response mode, your actions are going to be in line with that overarching ethos. And that's what we've seen with a lot of our work at the Gates Foundation over the last year. It is very much driven by those concepts of working with communities, adding value to the system, and doing so in a really sustainable way. And I think a great example comes from the work that our partners are doing, using genomics as a tool to track the spread of SARS-CoV-2 and these new variants of concern. You know, yes, we've got grantees in Seattle doing this. Yes, we have partners in the UK doing this, but we're also supporting this work to happen around the world, from Bangladesh to Zambia. And we're able to do this because we've taken that equity-informed view of deploying a transformative technology. So you can't just place a technology into a public health lab or a health system and expect results. You have to be cultivating relationships with scientists, with stakeholders on the ground. You need to understand the issues that are facing their problems. You have to be very honest with yourself as a funder that technology itself is very often the last piece of the puzzle, and it's really all about that upfront investment and ecosystem building and investing the time as well as the money.
Mm-hmm. Well, you mentioned cultivating relationships, and that leads me to Shivon, because I know, Shivon, that while you signed a 10-year partnership with the Rwandan government in March 2020, so this is giving every person over the age of 12 access to digital health consultations. Of course, that's going to be very critical. It has been critical over the past year. It will be critical moving forward. But laying the groundwork of those partnerships happened pre-COVID, happened pre-times of social distancing. So can you tell us, how has implementation gone for this partnership? What lessons have you learned? And what advice do you have, particularly for people who might be inspired by this conversation, but perhaps haven't laid that groundwork that it takes to make these partnerships work?
So our journey began in 2016 when we introduced telemedicine in Rwanda. But globally, we work in an environment where everybody uses their smartphone, but now we're coming into a place where only 10% of the population have smartphone, and the majority of the population use feature phones. And so we had to change, first of all, the way we do our service. So we have a call center in the city and employ over 100 doctors and 100 nurses to provide the telemedicine. And over the period of time, we've had to have partnerships with the government of Rwanda. We've had to be everywhere in the country where we put our platform in there. So we do the consultations, and we've done about 1.7 consultations since we started in 2017. We've registered over 2.4 million people, users. We do about 3,500 consultations every single day. So we really are everywhere in the country. And come COVID, we were all, you could say we were COVID ready, because part of the work that we were doing is to decongest health centers. And then later we were playing, actually in November, we started playing a more direct role because we're all dealing with all their symptomatic and symptomatic patients in Kigali. The highest number that we have received at any one given time was 6,000, and we're dealing with about 2,500, partnering with some companies in Rwanda who are, funding part of this work initially. But in terms of lessons, I think it's very important to realize the importance of partnerships, because while you're dealing with digital healthcare over the mobile phone, which is doing the consultations, you need partnerships when somebody's going to do the laboratory works, when you're going to do prescriptions. People are all over the country. How do you partner to make sure that you give them the care that they need? The other thing that I found really, really critical is the importance of universal healthcare, especially in the developing world, or even, the importance of universal healthcare or insurance of people, because people don't have enough money. And so even when you tackle the problem of affordability and accessibility, because you're using mobile phones people already have, it's still expensive when you're going to do your tests, when you're going to get your prescription. So there's a really importance of that. And maybe finally, the other thing that I've learned is the importance of adaptability. So you're coming into Rwanda, you want to deal with everybody, because our mission is to provide healthcare to everyone on earth. And majority of the people don't have smartphones. So how do you treat people and provide the care using the feature phones that they have? So you'll be able to adapt. And also, as I said, we started in 2016, meaning that there were so many things that needed to be done. The regulatory environment, the legislation is not there. So you start working through these things, and you don't have to wait for perfect to get started.
Great call to action, and love the emphasis on partnerships. Of course, that is what today is all about. Inder, I want to go to you. And I actually heard you speak a little bit earlier this year at another virtual event and knew we had to have you here at Prescription for Progress. So thanks for joining us. Kinsa is so much more than a smart thermometer company. You have a larger mission to build this early warning system for disease. So can you talk about how that played out in the lead up to COVID-19 and how connected devices can play into our strategy moving forward and preparing for future pandemics?
Catherine, thanks for having me. I'll start by posing the question that I posed 9 years ago when I started Kinsa. How do you stop the next outbreak before it becomes an epidemic, or God forbid, a pandemic, if you don't know where and when it's starting? And that was the question that launched Kinsa 9 years ago. Our mission since inception has been to create an early warning for outbreaks and to be able to forecast and predict how those outbreaks are going to spread. And what we did was we reimagined the first point of contact in the home with illness, the thermometer. And we piggybacked off of that behavior. Don't think of it as a thermometer that we've created. It's really kind of a medical guidance system that starts with a thermometer. But the key that unlocks the value is that consistent ability to talk to people when they're mildly symptomatic, well before they go to the healthcare system. And we get 3 unique data sets. We get where and when. Most of our users opt in for GPS location. So where and when are symptoms starting? How fast are they spreading? We literally can see in real time the attack rate, or a proxy for the attack rate in the household. How fast is it spreading in a household? How fast is it spreading in a school? And how severe is it? How long lasting is it? And what are the severe symptoms? Now, none of this is rocket science. If you want to know where and when outbreaks are starting, you got to know where and when symptoms are starting, how fast they're spreading, and how bad they're getting. And so we fast forward to March. In March, what we saw was an unusual rise in transmission and fever incidents across the country, and throughout New York, in Florida and Texas. And this was when there were first cases in King County and Santa Clara. There were no cases anywhere else. And we saw these hot spots developing. So we felt it was a moral imperative to get the information out there. We launched healthweather.us, which is where we display a lot of our data. And we analyzed the data over time. And we and now more than 200 public health colleagues have analyzed the data. And we found that it was a 3-week leading indicator of COVID-19 spread. So today we can provide up to 3, even 4 weeks leading indicators of future case surges. And part of the reason we've been able to do that is because of years of work on flu. What we're doing is taking the real-time data and subtracting out the fingerprint of what you'd normally expect from cold and flu, and what's left over is an unusual outbreak. So that's how we're hotspotting today.
So interesting. And one of the things I hope to get to in our group conversation in just a moment is, your background is in global health. You formerly worked with the Clinton Health Access Initiative. So to take the kind of work you're doing globally, including to low resource settings, what is the role of intermediaries? And I hope we can get into that in a moment. But first, I want to bring Abou into this discussion. And for those who aren't familiar, UNICEF is leveraging its experience as the largest vaccine buyer in the world to support countries to prepare their immunization programs for the COVID-19 vaccine rollout. So in that massive effort, I'd love for you to tell us, what are some of the ways you're partnering with the tech industry, whether it's smaller social enterprises we may not be as familiar with, or some of these larger tech companies whose names we know? Oh, and you're on mute.
Thanks, Catherine, for having me. Well, I mean, as you mentioned, I think UNICEF is the global procurement and logistic agency for the COVAX facility, who should be basically delivering the COVID-19 vaccines into 92 AMC countries, which are basically the low middle-income countries and the low-income countries. And in terms of technology, I think just looking in terms of having this vaccine management, stock management in delivering systems, I think technology is basically helping us of basically preparing the country. So we're utilizing open and source technologies in countries which are basically brought on by the governments, and to do their micro plannings, prepare the countries, tracking the vaccines from their point of delivery from the manufacturers all the way to the country offices. So that's really one of the major involvement where with technology are, but also in the producing of those vaccines themselves. I mean, technology plays a very, very big role. I mean, we have new technologies when we're talking about the messenger RNA vaccines today, which is basically a new kind of vaccines which we haven't seen before. But I think if I have to single out one of the most important impact of technology right now, it's really in the fight of infodemic. I mean, false sources. I mean, social media has played a critical role of informing populations, but not always with the best information. So you have the good information and you have the bad information. I think, we had to work with those with technologies as well to basically bring closer to the population the right information and convince them. In terms of vaccine hesitance, it's another issue which we're basically tackling as well, to really make sure that when those vaccines are reaching those countries, that the uptake of immunizations actually basically happening. And then the last point, and that's really for the future as well now, it's really with COVID-19 we have seen an exponential increase, in terms of waste, just because of the PPEs, because of the diagnostics, which are basically, multifold increased in every single countries. So new technology needs to be coming in, of really dealing with this entire medical waste in order not just to control the pandemic, but also making sure that we're contributing to the environment.
Thank you. And you mentioned the infodemic. That's certainly something we're going to get into today. In fact, following this session, we'll have another session looking at how the World Health Organization is partnering with big tech in COVID-19 response, and tackling misinformation has been a huge priority. I want to pose a question to all of you, and then maybe we'll bring in a question from our audience. But I mentioned earlier this point on intermediaries. So Inder, I know this is your background, if you want to come in first on this, and then would love to hear from others. When it comes to the potential of technology to play a really meaningful difference, both in tackling COVID-19 and ensuring continued access to other healthcare services, as Babyl Rwanda is doing, what role can intermediaries play? And I assume many in our audience are in those kinds of organizations. So Inder, let's start with you.
Yeah, partnerships are essential to achieving the ends that we all care about. Partnerships between organizations and partnerships between the public and the private sectors. In my experience, those partnerships between the public and private sectors can be challenging because of conflicts of interest, both perceived and real. Whether they're real or not is there's always a question when someone from the public sector is talking to someone from the private sector about why are they speaking? And so the power of intermediaries is to gain trust on both sides. At CHAI, we would play that role. We would play the role of being the honest broker between the private companies, the pharmaceutical companies who cared about making sure that they weren't losing money, who cared about making sure that their business was sustainable. They cared about these things, but those were different incentives and different cares than the public sector had, right? And the public sector cared about ensuring supply, ensuring quality, ensuring low price. So in my experience, the intermediary is really essential to making the system work. I'll just provide a very simple example. And I learned the hard way when I was at CHAI. Just to provide a very simple example, I remember I gave my first talk at CHAI, and it was an audience that included both public sector colleagues, NGO colleagues, and private sector colleagues. And I used the word profit. Oh boy, 2/3 of the audience just turned off. They literally turned off. And they just, I could see them just all of a sudden kind of, and that was an example of language matters. The way you speak to people, the way you talk about incentives matters. I learned very quickly that I needed to say reasonable return on investment, which is what I meant, but it wasn't what I said, right? And so language and understanding incentives of both parties to ensure that the collaboration is working is essential. And in my experience, the intermediary is critical in those public-private partnerships.
That's a really useful insight, just that one quick phrase and what a difference it makes in the room you're trying to reach. I see some nodding heads. What other panelists would like to jump in on the power of intermediaries? And then we'll go to a question from our audience. Go ahead, Abou.
Yes, I think, Inder has said it very, very rightly. I think for UNICEF, we are sometimes it depends on where we're standing on different ends. We can consider ourselves an intermediary, and sometimes we are at the other end. But just for the COVID-19 response, if you're looking at it, I think we are dealing with the farm industry who have basically developed, in record times, the vaccines. Now we need to deliver it to the countries so that it gets actually in the arm of people. So we are basically transporting those vaccines, to countries. We're utilizing, there's a huge partnerships which have been established in terms of transporters to help us basically in terms of transporting those vaccines in. They are received by UNICEF and handed over to the government. So there needs to be some kind of, trust relationship, to really make it happen. I think equity was a huge issue at the beginning, and we really had big worries that only the richer countries will be starting immunizing, and the low-income countries will not be basically accessing, those vaccines. COVAX was established. Yes, there has been some hiccups at the beginning, but our first planes landed yesterday, in Ghana, and it was from the COVAX facility, really making sure that the vaccine is distributed everywhere. So I think there needs to be this open discussions, and it might not be always easy, but there needs to be intermediary, because not one agency can do it all. There needs to be a partnership of basically undertaking these kind of actions. And I think the COVID-19 pandemic has demonstrated that we can work together, all together, to make an impact and really to overcome this pandemic.
Shivon, let me go quickly to you, because I am trying to put myself in the shoes of our audience, and I imagine that some others might be in a position like yours, a tech-enabled health organization that seeks to partner with governments, which is so critical. And you've successfully partnered with a government in a very big way in the work you're doing in Rwanda. So what role has this intermediary role, how has the intermediary role factored into your work in Rwanda, or what other partnerships have been essential?
From the very start, we've had to really work towards partnering with the government of Rwanda, looking to make sure that everything is done according to plan. So we've had to work really hard to make sure that that this is done, according to how we're doing it.
Starting those conversations early. Yeah,
it's really, it was really complicated, having to have conversations with different layers of government, people, the Ministry of Health, RSSB, the insurance companies, and so many other people that are intermediaries to get the partnership going. So it has really been 4 years of hard work of having to speak to have conversations with different layers of people to get there.
Yeah, absolutely. To hear that partnership, again, the groundwork was laid, as you said, in 2016. So these things take time. I want to go to a question from our audience. And in preparing for today's Prescription for Progress event, I had conversations with a number of different leaders working in tech, working in global health. And one of the really interesting companies I got to know was Metabiota. So let's bring a question in from Metabiota, and then we'll see what our panelists have to say.
Hi, I'm Nita Madhav, epidemiologist, data scientist, and CEO of Metabiota, where our mission is to make the world more resilient to epidemics. At Metabiota, we use data and analytic tools along with on-the-ground work in disease hotspots around the world to help governments and businesses prepare for, manage, and mitigate against human and economic losses from epidemics and pandemics, including COVID-19. Technology is central to our work. During COVID-19, we've seen firsthand how data and analytics have provided situational awareness, informed operational decision-making, aided in business continuity planning, and fostered the development of insurance and financial protections. All of these can help governments and businesses weather COVID-19 and future crises. I'm excited to be a part of Prescription for Progress today and ask our panelists the following question. In your view, how can the technologies that have helped during the COVID-19 response make the world more resilient to future epidemics and pandemics?
It's a great question because it's forward-looking in our just 3 minutes left. So I'd actually love to hear from Jen on this to start. I know this is something you have a perspective on.
Yeah, for sure. I'll tackle this from the data angle. And I think when it comes to combating future pandemics, data really needs to be a lot of things to be truly useful. But two of those things are unbiased and accessible. And those are two areas that I think are really ripe for improvement in the public and global health space. I think we've seen over and over again that inequity is a huge issue in COVID-19. And there's some really important lessons to learn around how do we ensure that health data is being collected in a way that is capturing underlying disparities and is being used to plan interventions that address those disparities. You know, Inder gave us a fantastic example of the potential of connected diagnostics, which is something that we at the Gates Foundation are really, really excited about. But we need to make sure that those technologies are being distributed in an equitable way so that we really are capturing a true picture of what's going on out there. And then when it comes to accessibility, we've seen huge issues with access to data, the ability to quickly integrate multiple data sources into one single platform. And it's actually, I think, telling that many of the resources that people are going to for COVID tracking information are actually volunteer efforts. They're not coming from any official government agency. And I think it really does speak to kind of a failing of a lot of public health IT systems to make data accessible and to make it interoperable. And really, like, if you don't have data, you don't have a chance of getting ahead of whatever disease it is you're fighting.
Thanks, Jen. Inder, we'll go to you quickly, and we only have about a minute left.
Yeah, I mean, the key point here is how do you identify a potential outbreak that has epidemic potential in real time, right? Because by the time the healthcare system sees it, it's too late. Person one has spread it to person two. Maybe they were mildly symptomatic or asymptomatic, but then finally person three gets it. An incubation period occurs, and then they're sick enough to say, I'm going to go to the healthcare system. It's too late by that time. By that point, it's already spread in the community. And I think that's where we need to start going to people when they first have symptoms. Connected thermometers, wearables, they hold the promise of collecting real-time data. Now, the key missing ingredient here, and this is the one thing I want to hit, is this is a reflection what Jennifer mentioned, is it has to be in those communities that are getting and spreading the disease. It has to be in underserved communities. Underserved communities don't have access to healthcare. They never enter the healthcare system in the first place. And we're very proud that 1 in 3 of our thermometers is given away for free to underserved communities, but we need that kind of global perspective. You have to have an underserved strategy in any epidemic. Newsflash, it's not new in COVID-19 that the underserved community is disproportionately affected. That is true in every single epidemic that has ever occurred. So the technology is an enabling factor, but we need those access programs at aggregation of data and the availability of data. I agree with Jennifer on all those points.
Well, thank you so much, everyone, for a great discussion. We had a question from the audience we didn't get to, which is around data security, but I encourage you all to use the chat, interact around that question of data security. I'll try to relay it to our panelists after this session and get back to that great question. But next up, we have a conversation on artificial intelligence and how AI can transform the way we think about healthcare delivery moving forward.